Welcome everybody to our next edition of our Spinal Workshops. I'm Dr. Ryan Weaver. Today we're going to be talking about one of the most common things that we hear in our office, aside from back pain, headaches. We're going to be discussing migraines, headaches, most common types. What are some of the treatments that you see for these? But more importantly, how can chiropractic care help with you? So again, Spinal Workshops, we do these talks every Tuesday. We find that a 10-minute video every week consistently keeps our community, our patients engaged and also educated as well. So diving into headaches, one of the most common things that we see, it's actually the most prevalent in terms of a pain disorder worldwide, which 50% of people would experience these. In America, headaches are actually the 5th leading cause for an ER visit. 5 million visits annually. So again, as you tune into this, if you've ever had a headache before in your life, this is something that you really should pay attention to, because as we stated in our title to this is, headaches are common, but they're not normal. You should not have headaches. A lot of people have them and a lot of people experience them, whether that is from a certain cause. You hear hangovers, alcohol a lot. Also, rebound headaches from other medications, and then the one that, I just had a headache. So, if you've ever experienced any of those, let's dive into this a little bit more. So migraines, you heard me mention those as well. Migraine headaches, are the most frequent type to the ER, and direct and indirect costs to Americans are up to $17 billion annually. So, getting into the causes, you're going to hear me reference the Mayo Clinic, you're going to hear me reference Harvard as well, some of the top schools that even they don't really understand or have unknown reasons why these happen. So, Mayo Clinic, a reference here, tension headaches are most common. The cause are not well understood though, and what they state the treatment should be is a balance of healthy habits and non-drug treatment. You heard me say that right. Non-drug treatment. So not over the counter, not pharmaceutical, non-drug at all. Let's jump to Harvard. Exact cause of headaches unknown. In part, how nerves of the head, neck, and shoulder sense pain. Okay? Medications 2 to 3 times a week did not improve it more, and also could cause a rebound headache. National Institute of Neurological Disorders and Stroke. Headaches, the most common form of pain and major reason cited for days missed at work and school. So last week, I believe it was last week, 2 weeks ago, time flies, I had the opportunity to speak in front of our Muskingum County Health and Safety Council. And when we talked about days lost at work, of course, back pain and headaches were some of the top 2 up there. Reference from the International Headache Society. There are over 150 types of headaches. 150. You hear tension, cluster, migraines, maybe name 5 to 10, but 150 types. So going back to what Mayo Clinic said, Harvard states a lot of these are unknown. Something I want to throw out there that even some of these references cite are cervicogenic disorders. In our office, what we adjust and what we treat are subluxations. Again, those little misalignments, such as a cervicogenic disorder, commonly known as, that can cause things like that. Headaches, absolutely. Other things, neck pain, into the shoulders, radiating pains, anxieties, stresses, other symptoms that we see along with this, dizziness. But right here, that they state that the cause is unknown, but also a reference in a cervicogenic disorder. So let's talk about common treatments that you see with these. Some of these, again, even when I read these, and I've done this workshop, probably one of the most that I've ever done, these still shock me. Treatments, obviously NSAIDs, over-the-counter drugs, triptans, Botox, antidepressants, anticonvulsants, anti-psychiatrics. Those are way more advanced medications that you see than just, here's an ibuprofen. Oxygen therapy, non-invasive vagal nerve stimulator, analgesics, oxygen therapies, calcium channel blockers, all of these things. There was a reference, most commonly prescribed pain relieving medication list as a headache as the top side effect. So most common prescribed pain medication, the number one side effect of that is a headache. So that was from MedLink Neurology in 2017. So what are some of the alternatives to those prescriptions and over-the-counter drugs? Well, number one, I'm obviously always going to say, have your spine checked by a chiropractor. Have that evaluated. Are the curves in the spine how they should be? Are things where they need to be? Again, that's going to help, especially when we talk about desk job ergonomics. 75% of our country leans forward. that can improve by chiropractic adjustments. From 2014, a reference from what we reference JMPT, or Journal of Manipulative and Physiological Therapeutics, chiropractic care has the ability to reduce both the intensity and duration of tension headaches. Tension headaches are most commonly caused or a result of stress, bad posture, which aggravates the spine and the muscles in the upper back and neck. Releasing the stress and reduce these kind of headaches with chiropractic care. So again, everything seems to focus around that area. And if it's functioning as best as it can, you see less and less symptoms and less headaches. But what are some of the other things that you can add into this? And a lot of these, again, if patients are away or on vacation or something, they can try lavender and peppermint oils, okay? Ginger, this can help with nausea if you have that with things such as like migraines. Magnesium, another big one there. B-complex, hydrate. I have made it a personal goal myself to increase the amount of water that I consume in a day. I typically have long days, so I gotta make sure I'm constantly drinking water because it's maybe easier around exercise time or if you're outside, but to stay consistent throughout, it definitely needs to happen. So, knowing that almost half of Americans, half of our worldwide population has experienced a headache, odds are probably you have as well. Again, if you're looking for something different than every day consuming some over-the-counter drug or a medication, or again medication that maybe you want to get off of, something to look at. And again, my call to action there would be to just have your spine checked. I had this conversation just yesterday that the worst thing we can say is we can help, then that's it. Having your spine evaluated and knowing, because not knowing is going to get you worse off the older that we get. It's easier to make healthier decisions at a younger age. But wherever you are in your health journey, starting somewhere by having your spine checked and analyzed will be the first step. So I hope you found some of these things interesting, educational, if not kind of eye-opening and shocking that some of these antidepressants and convulsants and things like that they give for headaches. So even the Mayo Clinic and Harvard really don't understand headaches that much as well either. So when we look back to this, again, have your spine checked, try to make healthier decisions, drink a ton of water, and again, continue to turn into these videos. So next week we'll have our following spinal workshop, and away we go, almost halfway through July already. So we look forward to seeing you then. Take care. Have a good afternoon.